Research shows that butternut squash can help reduce your risk of colorectal cancer. In particular, it can help your blood pressure. Butternut squash is high in potassium, which can help keep your blood pressure in check. Managing your blood pressure can reduce your risk for stroke and heart disease. We answer these 10 questions in this video. 1. What does butternut squash do for the body? 2. Is butternut squash a superfood? 3. Is butternut squash high in sugar? 4. Which squash is healthiest? 5. Is it okay to eat butternut squash every day? 6. How much butternut squash should I eat? 7. Is butternut a vegetable or starch? 8. Is butternut squash good for kidneys? 9. Is butternut squash good for your liver? 10. Does butternut squash burn fat? If you want to know. Don't forget to subscribe the channel and share with your friends for better health knowledge. 1. What does butternut squash do for the body? Butternut squash can support a healthy immune system. Butternut squash is loaded with antioxidants, specifically vitamins A and C, as well as beta-carotene, McIntyre says. These antioxidants fight free radical damage in the body and support the immune system. 2. Is butternut squash a superfood? And while we know it's delicious, this starchy veggie is actually a cold-weather superfood. In fact, while it contains more carbohydrates than other vegetables, like leafy greens, it provides an abundance of health benefits due to its richness in vitamins, antioxidants, and fiber. 3. Is butternut squash high in sugar? As for nutrition, a cup of cooked cubed butternut squash has just 80 calories, 22 grams of carbs, and 4 grams of sugars, and supplies an impressive array of nutrients. 4. Which squash is healthiest? Butternut squash. Butternut squash is incredibly nutritious. It's rich in minerals too. 89 milliliters of calcium, making it a surprisingly calcium-rich food, plus 1.3 milliliters of plant-based iron. It also contains 615 milliliters of potassium and 63 milliliters of magnesium for a healthy heart. 5. Is it okay to eat butternut squash every day? Butternut squash is a healthful option, but its high potassium content may mean that some people should consume it in moderation. Beta blockers are a type of medication commonly prescribed for people with heart disease. These can cause potassium levels to increase in the blood. 6. How much butternut squash should I eat? Butternut squash is deeply nourishing. One serving of cooked butternut squash, about 2 to 3 cups, packs about 4 grams of fiber, the digestion-supporting nutrient. For context, the daily value for fiber is 28 grams, so one serving gets you well on your way. 7. Is butternut a vegetable or starch? Starchy vegetables. Common starchy vegetables are potatoes, corn, peas, and winter squash, acorn or butternut. We need some carbs to keep our body fueled, and a great way to get your carbs in is by eating more vegetables. 8. Is butternut squash good for kidneys? With concern for potassium levels, consider having squash in small amounts. Squash can be a good choice for many peritoneal and home hemodialysis patients when you may need to eat more potassium-rich foods. Eating squash will not have an effect on forming kidney stones. 9. Is butternut squash good for your liver? A steaming hot bowl of butternut squash soup is a powerhouse of nutrition. With each spoonful, there's refreshing vitamin C, soothing magnesium, balancing potassium, and liver-nourishing beta-carotene. 10. Does butternut squash burn fat? 1 cup of cooked butternut squash has only 83 calories and provides 7 grams of filling fiber, making it an excellent choice to lose excess weight and body fat. It contains both insoluble and soluble fiber. Soluble fiber has been associated with fat loss and decreased appetite,